Good morning, everyone.
Good morning, Rich.
Thank you for coming to our wonderful building here. I think as you drive up and you see the beautiful rehab and the garden out front, it's how we have rehabilitated all of these buildings. But for today, actually, we're here to talk about, what else we're doing for residents, because it's really about making people's lives, make their lives better, not just with bricks and mortar, but how do we really impact people who need help, and how do we bring that to them? And this is what today is about. Before I get into it, we have a number of speakers, but I do want to recognize the wonderful board members of ours for the Housing Authority who have came. Our chairwoman, Wendy Williams-Walker. Thanks, Wendy. Our vice chair, Polly Keel. And one of our newest but most active members, Eric Slaughter. Thank you all for coming.
Here, here.
You're obviously integral to what we do. This is a long time in coming. This, when you come to our buildings, you see that how nice they look, but it's also evident that we house a lot of folks that need different services, but often haven't gotten them for a variety of reasons. Mostly because we have a system, a healthcare system that's been improved, of course, with universal access, but still has holes in it. And this program here goes a long way, I think, towards to filling those holes. We have put in place now 18 at all of our sites, 18 behavioral health specialists, case managers, and navigators to do a variety of things for our residents. Assess their needs and refer them to a specialist if necessary, but it goes beyond that. We're making sure that people who live in our buildings have access to all the state and federal help that they're entitled to, that if somebody wants to further their employment, go to work, there's going to be connections made to education, the community college system, and employment training. So this is really when you talk about holistic, I think this is what it is. And of course, things like this don't happen without leadership and political will. We are fortunate, President Biden and made this money available to states, counties, and cities, but we're really lucky to have a leader who saw the need, right? There's a whole lot of needs in the county, okay? A whole lot of needs. And this money could have been spent 3 and 4 different ways, times 4. But our special guest today knew that this was a huge priority and allowed the Housing Authority to make this program happen. She believes in healthcare as a right for everybody. I think we all saw the recent news about how medical debt was erased for so many people in this county. That's because we have a great leader who believes in helping people and acting on that. So it's my special pleasure to introduce our leader, Cook County Board President Tony Preckwinkle.
Good morning, everybody. Good morning. I want to thank you for that kind introduction, Rich, and for all your good work at the Housing Authority of Cook County. Before I begin, I want to acknowledge the folks who are with us today. First of all, Commissioner Josina Morita, whose district we're in, and she's also joined by Commissioner Monica Gordon, Commissioner Anthony Casada, and Commissioner Scott Britton. Thank you very much, Commissioners, for joining us. We appreciate it. Skokie Mayor George Van Dusen is here. Israel Rocha, the CEO of our health and hospital system. Patty Capuch, who's Executive Director of Impact Behavioral Health Partners. Dr. Sharon Ward, President and CEO of Grand Prairie Services. Cortez Riggins, who's a program participant. And Apostle Carl White, who, as I understand, is associated with Grand Prairie Services. Is that right? Okay. Now, did I miss somebody? Cortez Riggins is a program participant. He's also joined us. I also want to acknowledge representatives from the offices of Congresswoman Jan Schakowsky, Commissioner Dennis Steer, Representative Jennifer Gong-Gerchowitz. So thank you all for joining us. We appreciate it. We're here today at Armand King Apartments in Skokie to announce a groundbreaking partnership between the Housing Authority of Cook County, HACC, and Cook County Health that will greatly benefit our communities. You know, thanks to almost $6 million, $5.8 million exactly, grant from the American Rescue Plan Act resources, we've been able to add behavioral health care coordinators to all 18 of HACC's public housing communities, all 18. This initiative is a testament to our commitment to ensuring that every HACC resident receives the support that they need for their mental and physical well-being. Our behavioral health care coordinators will play a proactive role in providing resources, case management, therapy, counseling, housing stability support, and referrals to additional resources when necessary. This comprehensive approach will bridge the gap between mental health services and our residents, fostering a healthier and more resilient Cook County. I also want to express my gratitude to Cook County Health for their partnership and expertise in this endeavor. As a provider of both physical and behavioral health care, they've been instrumental in the development of this initiative and will continue to provide guidance throughout the program. Services will be delivered by two community-based behavioral health organizations, Impact Behavioral Health Partners and Grand Prairie Services. Impact Behavioral Health Partners will serve residents in northern Cook County, while Grand Prairie will cover southern and western Cook County. Both organizations have a wealth of experience and a genuine commitment to improving the lives of our residents. We look forward to hearing from them shortly. We recognize that mental health is an essential aspect of overall well-being, yet it remains an unspoken struggle for many. Through this initiative, we aim to reduce barriers to mental health care and ensure that all residents, no matter their zip code, have access to the support they need. I'd like to extend my gratitude to the Housing Authority of Cook County and Cook County Health for their good work. Together we can create a more inclusive and supportive Cook County where everyone has the opportunity to thrive. Now, I'd like to ask each person to introduce the person who succeeds them at the podium. And it's now my pleasure to bring to you Skokie Mayor George Van Dusen. Where are you? Right behind you.
Thank you. It's a pleasure to be with you this morning on this momentous day. I don't have anything to add to what President Preckwinkle said, except one of the things that we try to do in the village of Skokie is work intergovernmentally, bringing together the different units of government to better all of the residents of the village of Skokie. We have been proud to have Armand King in the village, as we do a couple of other buildings. My thanks goes out to the Housing Authority of Cook County Health, and the President's Office. Thank you very much. I look forward to continuing to work with all of you, and I hope anytime my office can be of assistance, you won't hesitate to let me know. Madam President, thank you for everything you've done for the county, and thank Behavioral Health and the Department of Health in the county. Thank you.
Thank you. Thank you, Mayor. Now I'd like to Commissioner Josina Morita, in whose district we find ourselves, to say a few words.
Good morning, and welcome to the 13th District. I would say, no offense, it's the best district in Cook County. We are one of the most diverse districts in Cook County with over 100 languages spoken. And so we have unique challenges in making sure that government is inclusive of all of the different ethnic, religious, linguistically isolated, culturally isolated communities across the 13th District. And to me, today is an example of government at its best. How do we partner across different levels of government? How do we problem solve and work together to solve complicated problems? How are we more than the sum of our parts, right? We can have social work, we can have housing, but how are we connecting these different pieces to actually help communities, individuals who need it the most. And so thank you to everybody here. Thank you to Madam President, to our colleagues, to our different partners at HACC and across the board here. It really does take a village. And so it's exciting to see these kind of partnerships that continue to take a place that could just be housing and make it a home and make it a supportive community. So thank you all so much. The boss said, okay. Next we have Israel Rocha, CEO of Cook County Health.
Good morning, everybody. Good morning. Good morning. It's a pleasure to be here with you all today, and I'm Israel Rocha, CEO for Cook County Health. I'd like to start by thanking President Preckwinkle for her ongoing advocacy on behalf of the health and well-being of all of Cook County's residents. Would also like to thank the Housing Authority for their vision for bringing us all here today. I would also like to recognize Commissioner Morita and Commissioner Britton, Commissioner Gordon, and Commissioner Quesada for always advocating and providing all the resources that Cook County Health needs to be able to thrive and bring new resources to life. And would also like to thank the mayor for having us here and all the distinguished guests. It takes a village, we always say, for mental health especially. Everybody is in it together. Mental health is an important part of everyone's well-being. It determines how a person is able to operate psychologically, emotionally, and socially. It is a critical component of one's ability to flourish. And especially when we look at the statistics. In 2021, 1 in 5 adults experienced a mental health illness, and 1 in 3 teens reported poor mental health nationally. It is clear that we have to take action today, and programs like this are doing just that. Mental health concerns impact every demographic, every age, and every sociogroup. We know that all too often, dealing with mental health challenges is silence, an internal struggle. One may not realize the negative impact that poor mental health can have, or simply too embarrassed to be able to say that they need help. And that's why today is so powerful. Today is one of the things that we want to always accomplish in Cook County Health is to make sure that we're bringing the right care to the right place in the right setting. And when it comes to mental health, being able to have what this program does, which is to embed social workers into each of the locations. There we go. Being able to place a social worker in each of the locations, it makes it a little easier for someone to be able to say that they need help. It makes it a little easier for them to access those resources they need. And it destigmatizes the entry into mental health. And that is really what this program is about, is moving and redefining what the door of healthcare means. So for that, we thank everyone who made this program possible. We thanks to the ARPA funding, Cook County Health is supporting the Housing Authority in placing behavioral health coordinators in each of their locations. And as a provider of physical and behavioral health, Cook County Health is supporting this initiative by our clinical and operational expertise. The health system assisted in the development of key performance indicators and provided guidance to support the program. Cook County Health is pleased to be partnering with the Housing Authority to reduce these barriers and make mental health that much easier to access. The program aligns with our overall efforts to make sure that behavioral health and all healthcare needs are available where people are, where they live, and that it becomes part of our everyday life. And so we thank everyone for their leadership. For a few words in Spanish, en 2021, 1 de cada 5 adultos experimentó una enfermedad mental y 1 de cada 3 adolescentes reportó problemas de salud mental a nivel nacional. Los desafíos de salud mental afectan a todos. Cook County Health se ha asociado con el Housing Authority para brindar experiencia médica y apoyo para un nuevo programa para colocar trabajadores sociales en cada edificio de la unidad de vivencia del condado de Cook. Los trabajadores sociales apoyarán las necesidades de salud mental de todos los residentes a mejorar su salud y bienestar. Nuestro sistema de salud seguiría buscando nuevas oportunidades para ampliar el acceso de la atención de salud mental para todo el condado de Cook. Thank you so much, and we're so happy to be part of this partnership. Next, I would like to welcome Patty Capuch, the Executive Director of Impact Behavioral Health Partners. Thank you.
Thank you so much. We are so happy to be here with all of you to launch this program and share with you our plans for helping keep people successfully housed in their community. Impact has been providing clinical services, permanent supportive housing, and employment services for adults with mental illness for over 35 years. We own 7 buildings in Evanston. We operate a 6-unit here in Skokie, and we are finishing up on a brand-new 16-unit not too far from here that we're very excited about. We also have 25 scattered site apartments that we rent throughout the suburbs of Cook County. And we have about 80 participants in our housing program, and we serve about 600 over the course of all of our programs in a year. We follow what is called the Housing First model. A lot of you probably already heard of that before, but means if you put a roof over someone's head first, and then you connect them to the supportive services that they need, they can then finally have the stability to start to address some of the things that may have led to them being homeless or unhoused in the first place. And we're very proud that the average length of stay of participants in our programs is 9 years. So if you think about that number, we have a lot of participants who come to us who've been homeless for years. We have some who have told us they don't even remember how many years they've been homeless, and then they're able to stay for an average of 9 years. And we have participants who've been in our program 15, 20, and 30 years. So just think about that for a minute. We have participants who've lived, shopped, worked, and just been a part of their community for 30 years. And we help our participants stay housed by a wraparound model of care that's been spoken about. We provide clinical support, case management, housing support, and employment for our participants. And when this grant opportunity came up to partner with the Housing Authority of Cook County, we felt we were a pretty good fit, and we are so thrilled that you felt that way too, because I think we have a good bit of expertise in helping folks stay housed. We knew that they wanted to kick off and start really quickly after the March 1st start date. Because we've done this work in our buildings, we were able to train and get staff up and going pretty quickly. So we are providing the case management, therapy and counseling, housing support and housing stability, and supported employment. And since the beginning of the program, which hasn't really been that long, we've been able to engage 70 residents in one of our services. Our case management team have been conducting groups. They've done meet and greets. They've done computer literacy, different programs. Our clinical staff employment, everybody has met and been in all 6 of the buildings, so they know that we can send those referrals there. Our team meets weekly with not only our team, but also with building managers and with HACC staff, just to see are the things that we're doing, are they working? And we then find out if there's somebody who is at risk for housing instability that might be losing their housing, or who also might need some mental health support. They're able to let us know that. So if somebody needs a therapist or a job or help with budgeting or really a variety of services, that they want to quit smoking, we'll help them do any of that stuff. I did want to just share a couple of things. Recently, we had some folks who are living in the building in Arlington Heights. They came to our case manager, and they said that they were feeling unsafe because of some criminal activity in the neighborhood. So our case manager listened to their concerns. He then went to the Arlington Heights police. They came to do a safety training for the residents, and the residents are feeling much safer in their homes, in their community, and they're feeling much more empowered about that. And before I end, I would just like you to imagine for a minute that you've lived in a shelter or in a tent for months or years, and you've been collecting things that you think might be useful to your survival when you're out there on the street. And now you have an apartment, and you're still in the habit of collecting those things because you're not quite sure what you're going to need. You've lived on the street for so long, and quickly your apartment becomes filled up and you don't have hardly any room to walk around. I share this because there's a resident we're working with in one of the HACC buildings who has significant hoarding issues. This resident was just able to clear enough space working with our housing staff so that their partner could sit next to them on the sofa. Now, that might not seem like a big deal, but to the resident who's been struggling with this, it was a really big win. And we are just getting started. And I would like to thank President Preckwinkle, the Cook County Housing Authority, all of you for allowing us to have this opportunity. We are excited to really be a good partner to you all. Thank you. And I'm going to introduce Dr. Sharon Ward, President and CEO of Grand Prairie Services.
Good morning, everyone. Good morning. And not to repeat some of the services, but we provide some of the same services. But did have a speech here that I wanted to talk about or present to you, but what I think is most important and what's going on right now is Community Emergency Support Services Act. It's legislation that allows everyone to have access anywhere, anytime, and any place to crisis mental health services. We can see the number of young people who are actually dying from suicide. And I'm sure you've already heard of the 988 initiative of at this time having the ability to call one number and have access to all of the crisis services throughout the state of Illinois. Grand Prairie Services is the regional advisory committee or the co-chairs and chairs for Region 7 in Illinois. And we're very proud that we've been chosen to be able to do that for the state of Illinois. Starting, I just have to go back a little bit. I'm not that old, but I am. I'm a senior. But I remember when I started at Grand Prairie Services 35 years ago. We were providing crisis services, if you can remember, Tinley Park Mental Health Center, located in Tinley Park, Illinois. We were actually located on the cottages in Tinley Park, Illinois. And at that time, our CEO had the initiative and the forethought that we would actually provide outpatient services for folks who are actually being released from Tinley Park Mental Health Center, who were homeless, but who also had no family. They had no resources, no access to care. And so Grand Prairie Services started our crisis services right there in the cottages on the campus of Tinley Park Mental Health Center. And today, we are the convener for Region 7, which includes Will County, Cook County, for crisis services. And so we're going to need everybody's help up here to be able to make sure that we save lives. And that's our motto at Grand Prairie Services. We save lives. We save lives because we provide wraparound services for individuals and families who otherwise would not have access to them. So that includes housing support, assistance with assistance, Medicaid, anything that you can think of, substance abuse services, we provide all of those services. We also provide medical health. And what we found, and the reason that we decided to transition and include medical services as a part of our continuum of care, is because people with symptoms of mental illness, at that time when I started, died 25 years earlier than anyone else. Now it's 30 years earlier than anybody else. And it's not because of symptoms of mental illness. It is because of the comorbid conditions that are not addressed with people who have symptoms of mental illness for various reasons. One is the lack of resources to be able to do that, the lack of access to health care, the lack of access to primary care, specialty care, et cetera. And we can go on. I only got 5 minutes, so I'm going to hurry through this. But I thought it was extremely important that we know that folks are dying. And the suicide rate for young people who are also living in our housing authority apartments is actually increasing substantially. And so we provide wraparound services for adults, for children, 24-hour crisis services for them, dialing 988, mobile crisis response team. So we go to wherever the crisis is. We also go to wherever the emergency systems are, follow them to the hospital, make sure they have access to wraparound services upon leaving the hospital. And there are so many other things that we provide for them. But today, we're talking about housing. And one of the things I think I spoke to one of the workers here with Housing Authority of Cook County. One of the issues that we have, we're seeing a lot of violence in the community among boys. And it's unusual that boys are also committing suicide. And so Grand Prairie Services saw this as an issue for the community and decided that we were going to think out of the box and we were going to find resources. And one of the things about young men occasionally is they don't generally come to therapy and counseling. And so we decided what we would do is partner with Mentoring Youth Through Technology to provide resources for them. They like to play the game. And so we were utilizing resources for them that would actually help them to be interactive, and they can actually learn social determinant skills, et cetera, while they're playing the game. But I'd like to thank the Housing Authority of Cook County, and of course, I would like to thank President Preckwinkle for this opportunity to provide these services. And there is so much more that I would like to say, but what's most important as well is we now have the opportunity to be where they live. We have the opportunity to go on site and provide all of these wraparound services. The opportunity for the housing managers to dial 988 or dial 331-0500 if a resident is experiencing a crisis, a mental health crisis in either of the facilities. And a team will come to that facility and provide wraparound services for them as well. And so thank you for your time. I appreciate all that you have done for us, and I appreciate the fact that you are also interested in saving lives, because that's what it's about, saving lives. Thank you for your time.
I would like to ask a program participant, Cortez Riggins, to come and say a few words. Cortez?
Okay. Hello.
Good morning.
Good morning. I'm I had a little in my throat. I'm Wendell Brown. I'm project director, and as Dr. Ward with Grand Prairie Services, as she said, we save lives. And to bring it from the page to the person, we have Mr. Cortez Riggins here, who is a participant. And I really want to thank the Housing Authority of Cook County and President Preckwinkle for this initiative, because it is vitally important. One of the major problems that we face, or barriers, should I say, is transportation. But now the residents don't have to worry about transportation because they'll have on-site services. And so without further ado, I'm going to let Mr. Riggins speak and give his testimony.
Good morning, and
Good morning.
thank you all. And first of all, I'd like to thank God who kept us all and continues to keep us as we go through this day. Man, you just don't know how it is to be homeless, to wake up and check for your stuff, or wonder if somebody just picked it up. Man, it's such a blessing, you know. And just a little bit about myself. I suffer from depression, but I didn't really know it, that I had been suffering all those years. Like someone had expressed up here, as a child, I was dealing with some factors, you know, in my life that I just couldn't explain. And I didn't know who to go to. I did not know I could talk to someone else. And when I came to Grand Prairie, it's to, you know, avoid, you know, going to court for some more DUIs. And I'm like, man, help me. And Grand Prairie, they took an interest in me. They put their arms around me. The staff, they just, man, they gave me something that I come from a family of 10 that I did not get. They just loved on me because I was there. I'm like, man, this got to be crazy. And I'm like, man, how can these people take an interest in me, and I have siblings who got tired of me using and not doing all that they felt I was capable of doing. And I'm like, man, I did not understand that. I found myself homeless for the past 9 years. Mr. Brown, he came there. He went above and beyond his call, I thought, to take care of me. The staff at Grand Prairie, they just wrapped their arms around me. And I'm like, man, what's going on with these people? Is this for real? You see, I watched that on television. I don't see that in real life. I did not see what I experienced from the staff. Walking in, man, how can I help you? How can I take care of you? How can I assist you? If you just get away from me, that's my mindset. Just get away from me. Let me just stay in my isolation, because that's where I feel comfortable at, alone. People don't know that when you're dealing with depression, that's the safest place, up there. No one can get in there. No one can get in there unless you let them. And when I began to give way and surrender a little bit more, and God allowed me to surrender a little more, and I just had to surrender because these people just showed me a love that I didn't find anywhere. And then they brought in the HACC. They came in and, can I assist you with housing? Like, man, you gotta be kidding. But God, I've been down so long, I don't know how to deal with this. I don't know how to wake up some mornings and not worry about what's missing. Where do I go? How do I rest? These two entities have afforded me peace of mind, along with the grace of God. And I don't worry except for the worries that I create. And I just ask that as God continues to be instrumental in your life, you continue to give up yourself. And don't judge that individual, man, that's standing on that corner or standing at that door or by your bank looking for something. A lot of times all you have to do is give them this acronym that someone gave me some years ago, that TIME, together, intentionally, making an effort. And that's what Grand Prairie and HACC has done for me. And I'm thankful. Thank you all.
Here, here.